Welcome back to Thirani. I'm Joe B. Have you ever wondered what are the 3 best exercises to improve knee bending after knee replacement? Let's dive in. After a total knee replacement, most of the time, the patient will have a limitation of motion towards knee flexion. During a partial knee replacement, the patient can also have a limitation of knee flexion motion. A total knee revision can also result to limitation in knee bending. After joint replacement, the post-operative swelling can result to disruption of the screw hole mechanics, where the tibia glides posteriorly and internally rotates during knee flexion, while the femoral condyles posteriorly rolls and externally rotates. The patella glides inferiorly during knee flexion as well. So the faulty mechanics will lie in the fact that the tibia can be stuck anteriorly and externally rotated. The femoral condyles anteriorly rolls and internally rotated, while the patella is stuck superiorly. To assess limitation of knee bending post-surgery, the patient will complain of stiffness towards knee bending, with confirmed limitation of motion during goniometric measurements and occasional foot drag during the swing phase of gait. To improve knee bending, a combination of range of motion and stretching exercise can significantly improve ROM. Less is more when doing exercise after knee replacement to avoid too much swelling that can further reduce knee bending. Start with heel slides for 2 sets of 10 reps before stretching exercises, with execution speeds at 2 seconds to bend and 2 seconds to straighten. After that, you can proceed to the first level stretch and the most comfortable of the 3, which is the supine heel slides with overpressure. Using a plastic bag to place the surgical side to reduce foot friction, the patient just basically slides the heel up to the buttock. After that, the opposite foot pushes that surgical knee far into bending, holding it for 30 seconds, hold for 3 reps. The patient can also use a belt or a strap in order to replace the pushing of the opposite lower extremity. The stretch can be progressed to the second level stretch, which is the knee flexion stretch on the steps, due to its closed chain nature. The patient leans forward on that surgical knee until a stretch is felt in the front part of the knee joint. The position is held for 30 seconds for 3 repetitions. Then the progression to the third and final level stretch will be the heel sitting knee flexion stretch, which will be held for 30 seconds, hold for 3 reps. The patient, while holding on to the parallel bars here, will try to place the surgical left lower extremity in such a way that the dorsal part of the foot will be on the seat cushion. From there, the patient tries to sit on his heel, bending the knee maximally. Once a stretch is felt in the front of the knee, the position is held for 30 seconds, hold for 3 reps, or it can be lesser if the pain is significant or higher than a 4/10. These exercises will need to be routinely performed once a day, every day, for consistent knee bending motion gains, with icing provided after 15 minutes so as to reduce post-activity excessive swelling. A knee compressive garment can then be used to prevent swelling, especially during foreseeable prolonged walking outside the home or in the community. If you like this video, please like, share, and comment. And for more therapy animations, please subscribe to Thirani.